Hold up.
There are so many nerves that come from the spine, and a lot of them are going to the reproductive organs, which helps, number one, getting your cycle ready.
The main thing that we focus in on as chiropractors, especially for those who are trying to get pregnant, is just making sure that there's no interference to the nervous system.
For me to reach out to my first time moms who are pregnant is just like, breathe. You have this amazing gift inside you. Just breathe, soak it in, and then we'll start making a plan.
So let's say, 4 or 5 months in and you want to start getting adjusted. Highly, highly recommend it. Number one, because your body's going through so many changes, and I've felt it because I am so clumsy. Like, I don't know where my body is in space, and I bump into things all the time. And but part of that is you have this wonderful hormone called relaxin, which relaxes all the joints, especially in your pelvis, trying to get you prepared and ready for that birth process where baby has to descend through the birth canal. Along with that, though, if joints are relaxed, that also means they can easily misalign or subluxate. And we want to make sure that we're not misaligned or subluxated, because that means a disruption in nerve function.
I was getting adjusted well before I got pregnant. I got adjusted throughout my pregnancy. And I got adjusted as soon as possible whenever I could move after baby was born.
When a mom's pelvis is torqued or misaligned or subluxated, it torques the uterus as well. And then baby has to adapt to that. So they're going to fit in the most comfortable position possible. That may be, sideways in the uterus. That may be feet down instead of, feet up. It just leads to a lot of different positions that a baby can kind of settle into. But now that's where Webster technique comes into play, right? We adjust those misalignments, those subluxations. We reduce that torsion along the uterus. And then just naturally, baby's going to go into the most comfortable position. And just like we've been doing for, hundreds of thousands of millions of years, however long people have been around, naturally babies are going to fall into that proper birthing position.
When both my girls being born at home, it was still an overwhelming emotional experience. Like, I was in the comfort of my home. Everything was on my time, my decisions. But still, once that girl was on my chest, there's not enough research out there that will convince me that we went from this perfect baby in the body to now it's out here and it's broken.
It takes 7 pounds of pressure to break a nose. And looking through the journal of obstetrics, in the birth process and just in a natural vaginal delivery, the baby's cervical spine is going through about 60 to 80 pounds of pressure. Just go ahead and get their spine checked immediately. Make sure that there is no interference to their nerves, to their spinal cord, and just start them off on a right foot, right? Like, the best thing that you can do across the board at any age, any time, is getting your spine checked, and babies are in that realm as well.
A lot of times we'll ask, Mom, how long were you in labor? The reason we ask is because baby was in labor just as long. So you talk about the stress of birth, that baby just went through the exact same thing Mom did. And it's important that they get checked. And I think a lot of times I have a lot of new moms that will tell me, oh yeah, the pediatrician said it's normal for him not to poop because he's being breastfed. That's not accurate. Number one, we should all be pooping every day. If we're not, let's go see a chiropractor. And it's kind of beautiful to see a baby get adjusted because it happens so fast. It was the best thing in the world. I got to adjust a 12-hour-old baby. And as soon as, it was about 15 to 20 seconds after I adjusted his tailbone, his little body scrunched down and he made a big grunt and just pooped everywhere.
My first pediatric patient that I ever adjusted, that was mom who was a VBAC. She brought her baby into me about a month after she was born, and she hadn't gone to the bathroom in about 2 days. Was extremely constipated, very colicky, and literally after doing a Logan basic adjustment on her, not 5 seconds later, baby had a blowout right on my chiropractic table. So, yeah, I was going to say, if you have a colicky baby or a baby struggling, to bear down and go poop, definitely chiro care.
as far as moms getting adjusted right after is highly, highly recommended. I probably got adjusted 30 minutes after. But same thing with our girls. They got adjusted within 30 minutes of being born, and that looked totally different.
Obviously, a baby comes out and you're kind of squishy. And the best way, or the way I describe it, is take your finger and indent the side of your palm. That's how much pressure we use to adjust a baby. It is that simple.
So if there was one piece of advice for anyone that is thinking about chiropractic care or they're newly pregnant, what would you say to them?
It's going to create one of the best environments in your body for you and for your baby.
Women are making these amazing choices and decisions for, especially when they're pregnant. So it would just top it all off to get your spine checked, making sure your nervous system is functioning and healing how it's supposed to, because it's not just your body that you are affecting. It is the growth and development of that baby.